Mycoplasma is a type of bacteria that do not possess a cell wall around their cell membrane. They can cause severe disease in poultry, mainly affecting respiratory system. Although there are 22 named mycoplasmas found in various avian species, there are only 4 which are established pathogens of domestic poultry: Mycoplasma gallisepticum (MG) and Mycoplasma synoviae (MS), which affect chickens and turkeys. Then Mycoplasma melegridis (MM) and Mycoplasma eoe (MI) are pathogenic to turkeys. Signs and symptoms of Mycoplasma. The signs and symptoms of gallisepticum infection very much depend on the presence of other poultry pathogens, particularly Newcastle disease, IBD, infectious bronchitis, and E. coli. The extent of disease is also dependent on the virulence of the strain of Mycoplasma. The age of the bird and the poultry species. Young birds are more susceptible than older birds. Turkeys are more susceptible than chickens. If not treated, the disease may persist from a few weeks to more than 18 months in layers. Disease can result in lowered egg production and reduced hatchability, and the downgrading of the carcasses of table birds. Uncomplicated infections frequently produce no clinical signs of mortality in older birds. The disease is often referred to as chronic respiratory disease, CRD. The most common clinical symptoms are associated with the respiratory system: iggy sneezing, coryza, that's a runny nose, and breathing through a partially open beak. Mild conjunctivitis is sometimes seen, with birds having foamy eyes and or swollen eyelids, and sinuses when complicated with other respiratory virus infection, or more commonly E. coli. Serious air circulatitis can result. Mycoplasma synoviae (MS) infection produce similar symptoms as has similar characteristics to MG. It commonly causes mild respiratory problems, although these can be severe under certain conditions. A less common arthritic form can result in joint lesions, lameness, and a resulting retardation in the growth of birds, particularly in intensively produced broilers. The foot and hook joints are affected in particular. A fluid may be produced in the tissue spaces of joints, which is initially clear and becomes creamy as disease progresses. In some chickens in an infected flock, the spleen, liver, and kidney can become enlarged. How does it spread? Disease is often associated with the environmental, nutritional, and social stress that sometimes occurs in intensive poultry systems. Large multi-age layer flocks are most at risk. The disease is most commonly spread from bird to bird, including nasal discharge, but can also be spread via infected eggs and on clothes and hands of people in contact with infected birds. There is also some evidence that the disease may be spread by wild transmission and other means. The rate of spread of the disease is variable, being rapid in some flocks and slow in others. Barriers such as pens can prevent spread of the disease. The adaptation of M. gallisepticum to a free-flying avian species presents potential problem for the control of mycoplasmosis in commercial poultry. When it comes to control and prevention, eradication of infection is the most satisfactory approach to control. Conventional control is normally initiated in breeding flocks by treatment of hatching eggs and monitoring of progeny for infection. Flocks may be considered uninfected when monitored progeny from disease-free parent birds and hatching eggs are shown to be free from infection. Breeding stock are now sold free of infection. It is advisable that breeding stocks are maintained in separate flocks of no more than 200 to 300 birds, as detection of infection will require the whole flock to be discarded. Mixing multi-age groups can increase the risk of spread of disease, so this should be avoided. The organism is susceptible to disinfection and under normal condition does not last for more than a few days outside the bird. Vaccines are available and may be used if the disease or risk of disease are present on farm. How can you treat if you already have the disease? Mycoplasmosis can be treated using a range of antibiotics. Although resistance to some antibiotics can be recorded and treatment normally means reducing the disease to tolerable levels. Diagnosis of either condition must be based on flock history, symptoms, and lesions. The blood test for mycoplasmosis should be treated with caution as it throws up a lot of false positives. Now let's look at some of the good practices that you can practice to avoid mycoplasmosis. Obtain chicks from disease-free parent birds. Avoid mixing poultry of different age groups. Keep dust and ammonia levels low. Monitor weather changes and take steps to minimize any effects. Check young birds first to avoid spreading disease from older stock. Maintain hygiene and biosecurity. Now that you know about mycoplasmosis, you can protect your poultry better.